Welcome to the selfgrowth.com show. My name is David Riklan, and I'm the founder of selfgrowth.com. Today, we'll be discussing how a healthful diet and lifestyle can help you reduce your risk of breast cancer. To help us understand this topic, I'm excited to interview Peter Goldstein. Make sure to listen closely. We're going to be sharing a lot of information today. Before we get started, I just want to take a couple of minutes and share some information about Peter. Peter Goldstein is a former CEO of technology and software systems and a lifelong advocate of personal power and conscious business practices. Over the last 10 years, he's been tracking a mounting body of evidence that demonstrates that we can save as much as 75% on healthcare costs in the United States and eliminate the associated human pain and suffering by simply changing food-based lifestyle. This is a savings of nearly $3 trillion a year, over 10% of our GDP, and untold amounts of pain and suffering. As a new grandfather, the other startling statistic that inspires this work is one that, for the first time in history, projects a shorter lifespan for children born today than those of their parents. That's just crazy. Peter is dedicated to changing that calculation during his own tenure on this planet. I love that concept. And I'd like you to jot this down. Peter Goldstein is hosting the new Radiant Health Dialogues, a breast cancer prevention summit. It's specifically focused on breast cancer prevention and includes 14 of the top health experts. And you can sign up for free. And I just want to give out this URL so you have it for later. Take this website down. It's radianthealthdialogues.com. That's radianthealthdialogues.com. And it's all this breast cancer prevention summit. And we're going to hear about that in a little bit. Peter, welcome to the show.
Well, thank you, David. It's such a pleasure to be here with you and with everybody.
All right, good to hear. I want to jump right in over here and start the first question. So we're talking about a little bit of food as medicine. How did you become interested in food as medicine?
Well, it goes back a long time for me, I suppose. I was actually doing some workshops with Tony Robbins, and at the end of his weekend workshop, he has a 10-day challenge for everybody that calls on everybody to commit to not eating animal products, to being vegan, to not drinking alcohol, and not smoking for 10 days. And when I went through that, I was motivated. And at that point, I decided that I can at least commit to being vegetarian. And I did, and it's been at least 15 years, and I've started feeling better immediately. So for me, it's been a journey, and it started out with just being vegetarian, and then I've started eliminating other animal proteins. And I've always worked out a lot, and I've been going on adventures and stuff. But it's been a journey, and the longer it went, I personally lost 50 pounds, and my triglycerides and cholesterol were totally off the charts. They weren't just high; they were off the charts. And my lifestyle, my diet have helped me lose the weight. Well, I hate to say it, but most men my age have found it and put it on. And so I'm really proud to have lost the 50 pounds and to have gotten my blood work really close to normal without medications.
Well, it's good to hear. Congratulations.
Thank you.
And
yeah, and then of course, the longer I did it, I started looking at the research. I had the pleasure of having a friend and mentor, Dr. Feinsinger in Carbondale, who actually showed that he prescribed food to his patients. And I wish more doctors were doing this. He found a source for plant-based meals, and he had his patients start buying it, and they didn't really have to know what to cook or how to cook it. But for a month, they got the meals, and in the process, they learned how to cook. And the outcomes are amazing. The outcomes across the board. There's lots and lots of doctors who are doing this now. There's tens of thousands of studies, and it's across the board. It pretty much always gets positive outcomes. It reverses chronic diseases. So looking at all this evidence, and that is the key to it. All these doctors are in it because it's evidence-based, because the studies are there. It's peer-reviewed scientific studies that show that food can reverse chronic diseases, and we can easily change our lifestyle and and reverse our progression of getting sicker and sicker all the time, because most people unfortunately are.
It's interesting to watch what happens and what's been happening. The stats I typically hear are roughly 2 out of 3 Americans are either overweight or obese. Our diet is horrible. If you take a look at processed foods and what we're eating, it's uh, and, and I remember some specific things in my life that really triggered some of this, and some of it has to do with what we're talking about, but just eating in general. I remember taking one of my kids to a birthday party for 4-year-olds. It's like a 4-year-old birthday party, and they were giving out Coca-Cola to the kids at
Yeah,
age 4.
it's terrible.
And I was thinking to myself, well, what have we learned? How are parents giving out Coca-Cola to kids at 4? And what we put in our bodies makes such a tremendous impact on everything, on our health,
Absolutely.
on how we feel, on disease, on just about everything. And I want to get into some of that with you. So
Absolutely.
one of the things I want to talk about is this concept mentioned, plant-based lifestyle. So what exactly is plant-based, and how's that different from, let's say, being vegan?
Well, so plant-based, in a sense, is very similar to vegan. There are a few distinctions. So vegans, the people who are vegan, they're very passionate about the animal kingdom and animal welfare. So they're vegan, not only not consuming animal proteins in their diet, but they'll go to where they won't wear leather coats or
Hmm.
anything else that has brought animal suffering. Plant-based folks are also, they're really focused on not eating animal proteins, so not killing animals for the food and not consuming those proteins. And unfortunately, both camps in our culture today, statistics show that the average American takes 100 animal lives a year for their food.
Really?
And yeah, it's just it's incredible. And the damage to the planet, we've deforested the Amazon so that we can have a place to graze cows to get hamburgers and that kind of stuff. And I mean, I can just go on and on about that, but that's sidetracking. But so vegan and animal based means really the common ground, most of it is common ground, is that we don't consume animal proteins, animal products of any kind.
Okay, that makes sense. Now, you talked a little bit about how you started and what motivated you, Tony Robbins and some other doctors. How did you get started being an advocate? That's how you got started for yourself. How did
Right.
you really start being an advocate for plant-based doctors?
Absolutely. Well, and where that comes to is, uh, I've always been very passionate about personal power, meaning that we can make decisions to empower ourselves and to live a healthy, happy life. And so I've always been passionate about that. I've always applied that in my own life to make my life happier and healthier and better. And to me, to look at how we're brainwashed by the food industry and the pharmaceutical industry, and in some cases the government, to believe that the wrong things are empowering us. So personal power to make those choices that are really feeding our health and feeding our souls and empowering us. Um, so that's what got me started. Then I started looking and with Dr. Feinsinger, I started seeing the evidence, and as it turns out, we can save. It's so huge. We can save 75% or more of our healthcare costs and all that associated pain and suffering. Dr. Ornish, one of the leaders in this movement,
Correct.
in his latest book, Undo It, he says actually we could save 86% of our healthcare costs. I mean, that's just huge. It's huge money. It's 10% of our GDP. It's huge. And but even bigger than that is all the pain and suffering. Dr. Furman, another leader in the movement, his research brought him to a saying where he says, "Live long and die fast," which is what we're not doing in our culture, right? So his research shows that if we treat our bodies well by eating whole foods, plant-based, we're designed to live 100 years and pretty much die overnight. So this thing of where the average American suffers for a decade or
Right.
longer with some chronic disease, this just does not have to be. That's not how we're designed. We just need to fuel our bodies.
Yeah, it's interesting. At times, it feels like the whole healthcare industry is just designed to create an extended period where they're treating us and generating income.
And
Yeah.
unfortunately, that's what it is. And it's a vicious cycle. I'm sure most of the leaders of the healthcare industry, they know that they're delivering a service, and they're trying to prolong our lives, and they're doing the best they can. But you know what? This is mind-boggling. So much of this is. But this, do you realize that most doctors today have never had a single class in nutrition? Their entire training has been about diagnosing
Right.
and prescribing medications and procedures. So, so they don't really know it. And the doctors, there's a movement in the medical industry to get doctors more education and exposure. And the doctors that I work with, they've had that exposure and they do their own research. And, a lot of them have started with with reading the China study, which is the
Hmm.
largest epidemiological study ever, and and it concludes that it is about our diet, it is about the animal proteins, it is about processed foods, and that along with tens of thousands of other studies. So really, to get back to your question, how do I get into this? I've noticed that we have this huge problem of the $3 trillion a year solution problem with our health. And then I realized that, well, we really actually have a solution for that. And that's the whole foods plant-based lifestyle. So we have a problem, but we have the solution. So
Right.
what's the real problem? Well, the real problem is that we have a solution that's not implemented. So that brought me to focusing to help implement the solution, which means to help promote the people who can support the consumer in changing lifestyle. So this starts with the doctors, and they're at the top of it, but it's nutritionists, it's yoga studios,
Hmm.
it's just everybody who can help us change our lifestyle. It's our life coaches, it's all these folks. So um, we have doctors. The doctors in our culture are amazing people. They have sacrificed and paid for it. And I mean, the hours they do in their internships and their
Right.
studies and on and on. They're amazing people. But then there's a subgroup, and that's the plant-based doctors. These doctors are amazing. They're tireless about getting the word out about lifestyle, about food as medicine. They live it, they prescribe it to their patients, but every chance they get, they're out in the community, they're out talking about it just to help more people understand that there's this huge solution that's just not advocated for by anybody in the government or the food industry. So that's my passion. So to help synergize and amplify the voices of these doctors, and then the other folks who can offer supportive services, that's my mission. I think that's how we can get to where my grandchildren can live longer than their parents, because that's the way humanity's always been, as children live longer than their parents, and we need to get back to that, and we need to get away from all the suffering and pain.
It's a great mission that you're on. And one of the things that always struck me is that I always felt that the medical system, especially in the United States, but also in many other countries, is designed to heal people who are sick, but not to prevent people from getting sick. That's
Absolutely.
that's been that's been the focus. That's what the training's about. All right, you have someone who's sick. How do you heal them? They're incentivized and motivated. The system incentivizes them and motivates them to heal someone who's sick, but not to prevent them from getting sick. It's just the whole system. There's a lot of things, but we'll
Absolutely.
we'll, we'll get back to that in a little bit. What I'd like to do is talk about a couple of things. First, I know you have a website. Can you tell us a little bit about your primary website
Well, our
and
primary
what's available?
right. So we're calling our work Hippocrates Docs. Hippocrates, named after the father of Western medicine in ancient Greece. We quote him as saying, "Let food be thy medicine." Um, he also authored the Hippocratic Oath that all
Mhm.
doctors
Right.
take. So we're honoring, and we're hoping to be inspired. And we asked the question, so what would Hippocrates do at this point if he who believed that food was our medicine was to see the processing our food gets now, and the terrible health everybody has. So hippocratesdocs.com is our primary website.
Hmm.
And And really, our mission with it is to help introduce people who are curious about food as medicine, about the resources. So somebody who would come to our website, they get exposure to the doctors and the research. And so we try and point out that this is all evidence-based, meaning that there's peer-reviewed scientific research behind it, even to the point where the NIH, the federal government's Institute for Health, they reviewed some of these studies, and they're on record saying that all doctors should consider prescribing a plant-based diet for their patients. So, so that's what we want to do, is we want to attract people who are curious and show them the 7 original heroes of the movement, show them the work of so many other doctors. There are thousands of doctors now who get it and practice food as medicine. And we would love for people to start seeing that there's a lot of validity here and a lot of power, and get people started on their journey to getting healthier by showing them these resources.
All right. So once again, the website is just hippocratesdocs.com.
Correct.
Folks. And I want to spend some time talking about the summit that you put together.
Thank you.
It looks phenomenal. I know you have 14 experts. It's called Radiant Health Dialogues. It's really, the focus is breast cancer prevention. It's what you're positioning as a breast cancer prevention summit. So a couple of things. I want to spend a few minutes talking about this because I think what you put together here is immensely valuable for anybody who knows someone who potentially might get breast cancer, had breast cancer. It might be for themselves, it might be for a family member or friend. I recommend this for anybody. And the stats that I've seen in terms of the percentage of women or men that get breast cancer is off the charts. The numbers are staggering in terms of how many people still to this day get breast cancer. So can you tell us a little bit about the Breast Cancer Prevention Summit? And first, can you share with us the website? Where do they go to sign up for it?
Yes, so radianthealthdialogues.com would be the place to sign up for it and to learn more about the doctors that are participating. The summit goes live. It is a pre-recorded summit. It premieres. It's available this coming Friday, and it will be a Friday, Saturday, and Sunday. We'll premiere new doctors for 3 days. It's absolutely free. There's no cost to it. We'll keep the recordings on live and for free for the rest of the month to honor Breast Cancer Awareness Month. That's the place to sign up. And this is kind of tickles me a little bit, I suppose. Is yes, we have 14 sessions, but the thing is that we actually have 3 of the sessions are by doctors who are married couples. So you get 2 for 1 in 3 of the sessions, and it's just so amusing. They're such beautiful people, and they're such caring people, and they have such great messages to educate people with. So we actually have 14 sessions and 17 doctors. One is not a doctor. One is a nutritionist, a dietitian, but all the rest are doctors. And we cover all kinds of things. And it's lifestyle. It's not just food. They talk about the general information about food and different aspects of food, but we also have things like stress management and breathing, and there's some other aspects of lifestyle that are really important. And so we get a taste of all of that in this free summit.
All right, sounds good. And once again, you can sign up. There's no cost. Radianthealthdialogues.com. So if you're listening, make sure to jot that down. And when we're done with Peter, take a couple minutes, sign up, and you can access. If you can't go to the whole thing, you can access part of it. A lot of really useful information. Now, I know this was also done in collaboration with the Physicians for Responsible Medicine. Can you tell us a little bit about who they are and what their involvement is?
I would love to. So actually, it's Physicians Committee for Responsible Medicine.
Okay.
And their website is pcrm.org. It's a nonprofit organization. It's absolutely one of the leaders of this movement. And it's led by Dr. Barnard, who we're really honored to have as one of the presenters in our summit. But Dr. Barnard has been leading this amazing organization. They're in Washington. They've been having annual meetings, and this year, of course, they didn't. But in August, they've been having live annual meetings where they have 1,000 doctors and practitioners attend annual meetings for plant-based medicine, for responsible medicine. They're leaders in the vegan community also. They're very much in it for human health as well as the animal kingdom and the health of the planet. So they've noticed the work we've been doing and invited us to collaborate with their initiative for Let's End Breast Cancer. So if you would visit their site and Let's End Breast Cancer, learn more there. And they have a 4-day a challenge. They have a 4-prong challenge. They feel there's 4 parts to getting healthy, including alcohol and weight control and getting exercise, as well as being plant-based. And they're amazing. Dr. Barnard and his organization have done amazing things. They've been lobbying the government. You know, it's really a shame, but the government publishes the food plate. It used to be the food pyramid.
Right.
And the story behind the scenes is absolutely unfortunate. You know, they start out with a set of standards and recommendations based on nutrition and fact and science, but then the lobbyists of the food industry, they impact the process, and by the time the guidelines are actually published to the American people, they are so different from what originally started out. And one of the things that we're celebrating now is that the next version will go a little bit lighter on milk. Milk, you know, it's been on the food plate and in the food pyramid. Unfortunately, milk is one of the big causes in breast cancer. And God, I hate to tell you about this, but it's just blew my mind when I heard about it. I heard about how I think it was from Sloan Kettering in their cancer ward. They now have girls as young as 12 with breast cancer.
Wow.
And they're linking that to milk and the hormones in milk and the food that we're consuming. But this is mind-boggling. I mean, not only the cancer rate is growing exponentially, but now we've got it down to our kids. I mean, it's just terrible. We need to change what we eat and how we live. We must do it.
All right. That's a really strong message. And one of the things you started talking about exercise and other things, diet, in my view, is critical. It's one of the most important. And I don't remember the exact quote. I'm going to paraphrase it. It's hard to out exercise your diet.
Absolutely.
You know, it's hard to, it's the summation of it, meaning if you're eating poorly, it's difficult to make it up through anything, through
Absolutely.
exercise, through meditation. Diet is really the core of where it all begins.
Yes.
And it's hard to beat that. So one of the things I mentioned in terms of the summit that you're putting on, just to give it out, it's a blatant promotion, radianthealthdialogues.com. Go check it out. And I know you mentioned the interviews are free. How long are the interviews, all these interviews from these 14 sessions, 17 experts, how long are they available for free?
They'll be available for free till the end of the month.
Okay.
And please sign up. We have some amazing gifts. We actually we're looking at also gifting folks who sign up our challenge series. So each of these doctors, so we've asked them to give us a lifestyle change habit. So and it's the core of our work. Our approach is that we built this lifestyle and this diet. It's taken us decades to get here. Some people can quit overnight and change their lifestyle overnight, but most of us need to have baby steps to do it. So as a gift for people who sign up, we're going to then publish a set of emails that each one containing a challenge for different lifestyle habit. So one habit at a time, baby steps. And so sign up and you'll be getting that also, a series of emails to just change one habit at a time, understand what, why, and how, and make that change and get healthy and reverse the direction of that the standard American diet that most Americans are on.
All right, it's a great message. We've covered a lot today. Before we finish up, do you have any final message you want to leave for our listeners, a final note or thought for everybody?
Well, I just really want to encourage people to be open-minded. I mean, it almost sounds too good to be true. I mean, to be able to change lifestyle and reverse chronic disease is it's just, but it is true. Be open-minded. Take a look at this information. Take on a few new habits. See how quickly and easily you can start feeling better is what I'd be telling people. I mean, it's just so powerful. For all diseases. And right now we're focusing on breast cancer, but and cancer's a little complex in being able to track just exactly what's what. But this same diet reverses diabetes. In a matter of 2 weeks, people start reversing their diabetes, their heart disease. I mean, just across the board. So please, my request would be, please be open-minded and check it out, and come join us for the summit, because we have an amazing sampling of doctors who practice food as medicine, doctors who, oh my goodness, I mean, we're probably out of time, but one of our doctors has actually had lupus and reversed lupus, which is something that Western medicine just doesn't have any idea what to do with.
Yeah, powerful message. Peter, thank you for joining us. And I want to recommend radianthealthdialogues.com. Check it out. Peter, thanks for sharing all this information today.
David, my pleasure. Thank you so very much. And everybody, thank you for joining us. Bye.
Well, you're welcome. And thank you, everybody, for listening. I wish everybody great success in all areas of your life. We'll talk to everybody soon.
Bye-bye.
Bye-bye.
Thank you, David.